Hi, and welcome to Healthcare IT Today. I'm Colin Hung, and today I am joined by two important individuals from Duke University Health System. I am joined by Ali Alexander, Digital Strategy Analyst, and David Claxton, Delivery Lead for the Digital Strategy Office. Thank you to both of you for joining me today on the program.
Thanks.
Yes, thanks for having us.
So I'm excited to talk to you because we're going to dive into some of the technology underpinnings behind this amazing Duke smoking cessation program that we've talked to Jillian about, and kind of talk a little bit about some of how the triggers work and how some of the technologies work. But before we started, David, you were mentioning something about, hey, like all this technology is great, but if that program isn't very good, this doesn't happen. Do you want to expand on that for us?
Yeah, I think the main thing is a takeaway with any technology that's implemented in healthcare is it's one aspect of the reach to patients. And although the work that we're doing with Zelf is great, and I think this is a great program that we set up and the way that we're reaching out to patients, I think if we don't have the success of the Digital Strategy Office and the work that Dr. James Davis and Jillian are doing with their team, and the accomplishments that they've been able to see, I don't think that we have near as big of an impact with the technology side of it. So I think they go hand in hand together, and having that successful program that they've built is key to this, and they deserve all the recognition for the work that's been done.
Well, thank you for saying that. I think it's definitely very true. Sometimes us in the technology realm, we get enamored with the technology. We forget that there has to be a whole program and a whole set of people that have to deliver on after that technology point ends.
Absolutely. We have, we can call it the easy part of, we can put the technology in place, but somebody actually has to take the operations and really drive the success metrics.
So let's talk a little bit about the triggers, because Jillian was talking about how as soon as the information is entered into the EHR that someone is a smoker, then there's some nudges that go out of the system. Can either Ali or David, you explain kind of that process?
Sure, I can take a first stab at this. So one of the things that we recognized early with the smoking cessation program is we identified that they have a great video that Dr. Davis walks through and explains all the positives and all the ways that they can help people quit smoking. And we really wanted to be able to get that to patients and make them aware of this program, because I'm sure there's plenty of patients out there that may want to quit but just don't know the best avenues. And we want to make sure that people are aware that the cessation clinic is there. So one of the things that we thought about early is how do we make this available and easy for patients to be engaged with, especially at the time that they're seeing and working with somebody at Duke, a clinician. And the way that we went about it was anytime that somebody is documented in our EHR as a smoker, and tobacco cessation, or excuse me, tobacco use is something that is reviewed at each visit. So we know it's accurate when it's in the system. We wanted to make sure that anytime that they schedule an appointment and we notice that they're a smoker, that we offer this and make them aware that the smoking cessation clinic is available to them. And I think one of the real neat things that we did, and it was the first time Zelf had done this, and I think this is a tribute to how Zelf and Duke has worked together to better the offerings that we put out together, is instead of just sending the video and hoping that the patient calls and says, yes, I'm interested in this, what we did also is attach just one simple question to say, would you like to receive more information? Would you like a phone call? And if the patient clicks yes, that information is then sent to Jillian and team to make sure that they reach out to the patient. So then we're proactive with reaching out to the patients that we know are interested in looking for that guidance and that help. So I think that was something that took it to the next level, rather than just sending them a video and hoping that people reach out to the clinic.
And Ali, if I can ask, how do you send that video? How is that delivered to the patient?
So the patient will first get an email to whatever emails on file in their chart that they have new resources in digital care that have been recommended by their physician. And then once they log into digital care through their My Chart, and it's super easy to get to, all of the content that's been just prescribed for them through digital care lives there. Mm-hmm. And they can watch the video. I actually have it pulled up now. up to you if you want to see it. And then on that, that they watch the video right from there. And then on that card is what we call it. There's that yes, no question that David was talking about. And then that yes, no question actually sends an in-basket message that, Jillian and her team look at, and then they create the referral from there.
Amazing. So you send an email to them to let them know that, hey, you should come to the portal. And then when they log into my chart, all their resources are right there and they can watch that video.
Right. Mm-hmm.
Great. And is it just a single email? Do you send it multiple times? Is there some sort of like drip campaign, if you will, to borrow a term from marketing, or is it just a one-off and that's it?
There is a one-time email for this use case. We do have other use cases where so through digital care, you can actually see if someone's interacted with the content that's been sent to them.
Oh, okay.
So, the physician or whatever, the clinician can go to digital care and Epic and see if the patient has actually looked at the video or not, whether or not they clicked on the card, the yes or no question. But if they haven't, they could always reach out to them. But we do have use cases where Zelf, the third-party vendor that we're working with on digital care, they can see whether the patients engage with the material and they can send a reminder email. I don't think we're doing that with this use case. David, is that right?
Correct. So for this,
Okay.
and I think this is a big thing to add as well, is for this use case, we're not sending that reminder email, and we're only sending this to the patient yearly. So let's say a patient has multiple visits with Duke in a year. One of the things we wanted to be really respectful of is not bothering patients or creating some sort of noise or annoyance with this, because smoking can be a very touchy subject. And this is one of those things where we wanted to err on the side of caution and say, let's send it once per year. And then if the patient doesn't engage with it inside of that year, and they come back to Duke the next year, let's send it again to them. Because we want to make sure that we're offering it to them. We felt the year was an appropriate time frame for this, to make sure that we're respecting the patient's willingness to work with the program or interest. And then also the patient, if they want to be out of if they don't want to receive it anymore, they can work with Jillian and they can get off the list of being sent the information. So we wanted to be really respectful of patients there.
I like that. I like that approach. It's amazing that Duke has seen the results in terms of enrollment just based on a single nudge. Because Jillian was talking about that phenomenal jump in enrollment after the videos have now been sent out, and now I'm hearing it only goes out once a year, and to see that jump, that means a lot of people were willing or ready to quit, but just this extra little prompt at the bottom where they could just click yes and have someone connect with them, seems to have made all the difference. That's amazing.
I think that's a great point. And I think it's one of those things where patients and people in general are more comfortable interacting with things online. And I think it's one of those things where in a clinic, having a conversation with a provider, as our providers do, they offer these programs to patients. It's one of those things where I think patients feel more comfortable when they're online, being able to reach out and say, yes, I do want help. So even if a provider talks to you in clinic and at that point in time, you may not be ready, as Ali said, this thing persists and lives there. So you can go back and watch it and then later decide, maybe I do want to explore this option. And I think it's just another way for us to reach patients and give them those options. And I think, like you said, we've seen great success and hopefully we continue that. And I think it talks to also being able to push things to patients at the right time while things are at front of mind. And I think those are the things we've seen the greatest response to and interaction with as far as digital care so far.
Is there anything else that you're using, or is there any other messages that go out as part of this program? Once, let's say after they've signed up, is there anything else that you use either MyChart for or Zelf for?
As far as Zelf, there's not anything additional after this message goes out. The clinic itself may do some work by sending MyChart messages to the patient and staying engaged in that aspect. One of the things that I think we should also mention that we didn't at the beginning with the email is, as long as a patient has an email on file, they'll receive this. So meaning if they don't even have a MyChart, if they have an active email on file, they'll receive that first email. And that first email for patients that don't have MyChart will say that you have something sent to you. We notice that you do not have a MyChart. So please, here are all the things that are beneficial in MyChart, sign up, and that will be waiting for you. So I think it at first, when you hear it's just MyChart, you think that there's probably limitations on the patients that receive this information, but then to take it that next step, anybody that has an email on file, we do offer this too. So I think it's an even added benefit as well.
So you're not only getting people signing up for the smoking cessation program, but you're getting more people onto the portal as well.
That's our assumption, and that's something we're working towards hopefully measuring in the next year to understand what type of impact does sending this to somebody that doesn't have a MyChart have with the sign up into MyChart, because there's a lot of great work that's being done and a lot of things that are offered through MyChart, and especially here at Duke, we're actually taking the next step with our portal, our MyChart, and creating more of a customized Duke app that we're calling My Duke Health, to be able to really deliver things that we feel patients need to have digitally.
Ali, just a question about that email that's sent out to the patient. Is that something that Jillian and her team craft? Is that something that the IT team has to help them with? Who maintains that side of things?
So that's actually something, and David will be able to speak to kind of the birth of it and how it was, but we have a kind of a generic email template that says, Duke Health has recommended something in your digital resources, because for this use case, we're basing the automation on just the next appointment that the patient has. So it's not necessarily that provider that is prescribing this information, right? So that's a good use case for that kind of generic email. But then there's also another template for more specific that says, this still says the patient's name, but it says the provider's name has recommended digital resources for you. And then, like David said, we have also the third email option for the patients that do not have MyChart yet.
Gotcha.
Yeah,
Gotcha.
I think to add to that, we have the different email templates, and we have flexibility as we put we call them assets, as we put different assets into production to create different email templates to work with those if necessary. But I think to your question, Colin, is we work heavily with our clinical partners to make sure that everything we're putting out there, whether it's the verbiage in the email, the verbiage in the card, the timing of things getting sent out, the actions, all of those things are heavily driven by our clinical partners to make sure that we're putting out what they envision and how they think it will be successful, and we work with them to measure the success, because we in the IT world, we can understand how the IT part of it will work, but we really need and we really rely on our clinical partners who are experts in those domains to help us make sure that we're delivering the proper things to our patients.
And how did you arrive at Zelf? Like, was it a tool that was already there at the hospital and you just used it, or was Zelf chosen for this application?
Yeah, we implemented Zelf in April of 2019, and we put the smoking cessation asset into production a few months after that. So we already had Xealth at that point, and one of the things as our team in the digital strategy office does is we are working closely, like I said, with our clinical partners, and what I think Ali does a fantastic job with, along with other people in our department, is being able to see things that are being done in the health system, and then being able to make those connections to the work and the tools and the assets that we have available at Duke in the IT department. So this was one of those things where we saw the smoking cessation group had this great success, and we saw that they had this video. So we made the connection to say, why don't we try something with Zelf? And we approached Jillian to say, we have this option. And to Jillian and Dr. Davis' credit, they instantly got it and said, yep, let's do this. Let's go forward and let's do a pilot. And as you've heard, the success of the pilot then grew into the larger production to every smoker who has a clinical visit will receive this. So I think it's the combination of being able to identify and see these opportunities that, as the digital strategy office does, and then being able to work closely with our clinical partners.
Wow, Oh, so is the office, it sounds like the office is sort of taking a broader look at the technologies that are deployed at Duke and saying, hey, it's got some success over here. Why don't we, there might be a need over here. Let's take it and use it. It sounds like
Yeah.
part of the mandate is to leverage the technologies that you've already got in places that need it.
Absolutely. I think one of the things that we pride ourselves in the digital strategy office and our chief digital strategy officer, Matt Roman, is understanding the different technology that we have available and that we're working on and the connection points to that. You know, for example, Zelf is just one of those aspects. My chart obviously works hand in hand with Zelf, and the work that we're now doing with the patient portal to make it more customizable obviously works hand in hand with all of that. We're also implementing Salesforce into our call centers, and we know that there's direct interactions with that. Chatbots we're working on, and that's going to be again with our portal and with our new Duke app that we're creating. So I think one of the things that we really pride ourselves on, and we make sure that we are doing a good job of, is saying to our clinical partners, come to us with what you're trying to accomplish, and you don't really care which one of these things does what you need it to do. We'll help figure that part out, and we'll make that easy for you. Our goal, anyway, is to try and make that easy for them. So really, come to us with what you're trying to solve, and we'll make sure that we apply the correct technology to that. And I think so far, we're seeing these connection points really start to ramp up, especially within the last year, understanding COVID has turned the world upside down and how we deliver care. But I think it's been a positive in some aspects of really driving innovation and speed to some of these things that we've been trying to accomplish.
Amazing. That's a really good model, because a lot hospitals are very big organizations, and a lot of times one department implements a technology and other departments don't know about it.
Absolutely.
Now, where are you using? It sounds like you're using Xealth in other places. Is that a fair statement?
Yeah, absolutely. I think we're seeing a lot of growth in the use of Zelda, and I contribute that largely to Ali joining our team last year in March and really taking over and driving the process and really evolving the work that we've done with Zelf. Zelf will tell you themselves that they're still a relatively young company, so I think the work that Ali has done with them to really drive an implementation strategy has been fantastic. I think some of the other things that we've seen some big success with is things along the lines of delivering education content, one of them being around hip and knee replacements. We understand once COVID hit that in-person visits for these types of group visits that we've seen in the past are no longer available. So what we wanted to do there is make these tools that they've been receiving in those classes available to them, and we send them prior to a surgery based on the patient being scheduled for a surgery. We send them 8 weeks in advance to say, here's your information about your hip and knee replacement. Please watch these videos. And again, I think this goes back to what we talked a little bit about, the positives of the smoking cessation clinic video is it lives there. So the patient can watch it on their own time. They can go back and review it, because very well, if you go to a class, you may get some information and you're not going to remember it all. So this allows you then to be able to look back and understand that information again when you need it. And one of the other things I'll probably ask Ali to talk more about, because she's been deep in it, is our integration with HealthWise, our education vendors. One of the big things that we're really just starting to push towards, and some exciting things are happening within the next few weeks here. So I'll let Ali talk a little bit about that.
Yeah, so I did want to mention, we have since April, when Zelf came, to Duke, there's been a lot of changes and evolving, with kind of challenging them with new use cases, and all of that. So HealthWise, we just finalized being able to review, like this sounds really small, but to be able to preview content before it's prescribed to the patient. Prescribed means sending, ordering. So be able to view the content before the clinician prescribes it to their patient. So that'll be coming at the end of March. And then we're also working with HealthWise on a new search API. So right now it's a slightly cumbersome process to get Duke custom content loaded into the health reference library, which lives in Epic, and that's the HealthWise library. And then also manually uploaded into digital care. So coming 2 to 3 months, the new search API will give us the knowledge, the health reference library that's in, that the patients can access. And then they'll also get, the clinicians will also get the clinical references library for HealthWise, and also all of the Duke custom content, all in digital care. So it'll all live in one place, which is a huge thing, because having lots of libraries and different content living in different places is very confusing. So that's been really cool. I wanted to mention also the DSO is involved with all of the telehealth stuff that you can imagine has become very, in the past year, kind of like, we need to do this now really fast. And within the last maybe 5 months, group telehealth visits have become, we've been rolling those out for different departments. So those departments are the departments that are using the group telehealth visits are also using digital care to send their content to patients before the class. So the patient has something to reference, while they're taking their group class, which has been really cool. We have a use case with the spine group where we're actually sending them a class registration link first through digital care. And then once they're registered for class, they get the content. And then after the class, they get a survey about the class. And that's all being sent through digital care. So that's a pretty cool, kind of complicated use case.
I think one of the things that you're hearing here, Colin, is it allows us to be nimble and try new things and different things, right? So one of the things I think that we hopefully pride ourselves on is being able to see these opportunities and try something new. And then at the same time, understand if it's not working, we can take it down, because we don't want to leave something out in production that is not working and not useful. But it gives us that opportunity to try some of these things that we think will be successful, that we haven't been able to do previously without the Zelf interaction. One of the things I do want to mention with the HealthWise, because I think this is key to the integration, and we're hoping to see success here when we go live with this in April, is right now, anybody that has Epic MyChart understands when you get your after visit summary and there's education content added, you either get that printed paper and you probably keep it or throw it away or lose it somewhere around. If you're anything like me, I lose it pretty quickly after I exit the clinic. And if you want to find that content that's been assigned to you, whether it's a video through HealthWise or whether it's just plain text, you have to go back and find your old appointment. And for somebody that may have multiple appointments, it may be hard to remember which appointment I received that information at. But with the HealthWise integration, what it allows us to do is, if it's a video sent, it goes directly to digital care. I can watch it in digital care along with all the other education content I've been sent, whether it's smoking cessation or some of these other assets that we've been talking about. Or if it's just plain text, I can read it right there in digital care. So it brings everything in one area, hopefully makes it a lot easier and a much better interaction experience for the patient to say, oh, here's my content that I need to review, and I can go back and review it easily whenever I want to. So I think that's one of the big things that we're hoping to see with the HealthWise integration that goes live in April, to have that uptake in people reviewing that information.
It sounds like one of the, I guess, ethos of the DSO is to work very closely with the vendors that are doing business with Duke. I mean, you mentioned before how closely you worked with Zelf to kind of get them to tune their system a little bit more to the smoking cessation program. You just gave an example of working with HealthWise. Is that sort of the DSO's approach, to really work with the vendors to have them really make sure that their system can be adapted to how Duke would like to use it?
I would say absolutely. I think that's key. And I would also want to make sure that we appropriately give the recognition to our other teams within Duke, our Maestro, we call Epic Maestro Care here. So our Epic analyst teams that do a lot of this work, also within MyChart and also within Epic itself. The digital strategy office couldn't do any of these things without the help of those areas, especially the Epic integration partners along with that. So there's a lot of people that help make sure this is successful outside of just the digital strategy office. So I think there's not only the partnership with our vendors, it's a close partnership with the people that are actually pushing the buttons and making sure that Epic is doing what we need it to do and the integrations are tight, because without that, we wouldn't be able to do any of the work that we're doing currently in the digital strategy office.
Mm-hmm.
last question for both of you. If there are your peers at other organizations who are working with these kinds of technologies, working with the clinical groups, what advice would you give them if they're sort of in the middle of a project and maybe it's not going so well? What would you tell them? What advice would you give them?
Hmm.
We'll start with you, David, and then we'll go to Ali.
Yeah, I think the big thing to keep in mind and what we try to do as we approach these projects, and obviously it's more difficult depending on the project, but what is necessary to get up and running to see if something is working. So meaning what is a minimal viable product? It doesn't have to be absolutely perfect to start. And granted, again, it depends on the type of assets and types of things that you're doing. Some things may need to be much closer to perfect than others, but for a lot of the things that we're doing currently with Zelf, we want to just make sure we get it out there and understand how it's working and make sure we're working closely with our clinical partners, and we're aligned there because we don't want any surprises. We don't want them to be surprised. We don't want to be surprised either. And we want to make sure that we're tight there. But then also measure that and understand, is it working as we thought it would? Is it not working? And make and adapt to changes as we need to. I think that's big. I think the speed to get these things in is extremely important nowadays, because you don't have time to waste and you don't have time to stack up these different projects, because one project, like we're talking about the tobacco cessation, the success of that can then lead to multiple projects that we're now working on and showing people what's possible. So I think my key advice is, don't try and get to 100% if 80% is good enough, and make sure that you get that 80% so then you can move on to the next thing and measure that success.
Mm-hmm. Yeah, I'll add to that. I think that was really good. I learn something from every use case that the next use case that I do. And there's a lot of moving parts. I'm very much in the weeds with communicating between the clinical partner and Zelf, and getting those details together. And smoking cessation is actually one of the more simple criteria use cases that we have. So for me, it's very important to go back to what the clinical partner is trying to accomplish. Like going back to that root of why are we doing this? Because you can get very lost in the criteria and the ICD-10 codes and the data being transferred back and forth. Especially since we're starting to look at ROI on some of these use cases where you have really high engagement. First thing we ask them is, so tell me about what you're trying to accomplish in the beginning with this, like, why did you do this to begin with? So that's a really good thing to kind of keep us on our toes. And like David said, we tweak things, as we go, like we add those reminder emails, or we exclude surgeries that maybe these patients shouldn't be getting content for, so it's ever evolving. So we like to revisit projects very often.
And I think one of the things to add there too is as Xealth continues to Xealth in particular is develop, one of the things that we see is new things are coming that we may not have had access to when we first put something into production. So we have to revisit and say, does it make sense to change how we're doing this? And credit to Mike and Aaron at Zelf for the work that they're doing and the work that we're doing together, because I feel like we have a good relationship where we at Duke are helping them understand what we're trying to accomplish, and they're seeing what we're trying to accomplish and really working to help us in those areas. So I think it's one of those things, like Ali said, what are you trying to accomplish and how do we do that for you?
Well, thank you so much to both of you for sitting down with me today. I mean, we've covered a lot of ground, and it was really fascinating to dig deeper into how you're using Xealth with the smoking cessation program, because again, the results have been amazing, but also just to learn a little bit about how your digital strategy office really is approaching things within Duke, and that's a pretty amazing office and approach that you have there. So thank you for sharing that with us, and I do appreciate your time.
Absolutely.
Yeah, thank you.
This has been Colin Hung with Healthcare IT Today. Thanks for listening.